math problem on here that will relate. So whatever you figured out to be your math problem, that's how much you'll draw up when you come in, okay? So for your sub Q, we'll do that at one station. You'll do sites, and then you will draw up the medication, and then you will give it into the pad using the correct technique. So that's it for your sub Q. I'm going to assume that you've already checked the MAR, washed your hands, all that stuff. So the basic thing is just to come in, draw it up, put your gloves on, clean the site, give the medication, okay? And then tell them where the sites are. For your IM, it's the same thing. There's a math problem on here, so whatever you calculated for that math problem, it would you physically draw up. So same thing, come in, demonstrate the sites. I'm going to assume all that check has been done. You will draw up the medication, check it with me, put your gloves on, clean the site, give the medication. So sub-Q IM. Same thing for intradermal, except for we'll just tell you how much to draw up. It's just a technique kind of thing. So you'll do all three of those. For your oral, that is the one that you do have to kind of tell me a little bit more about so that I can see that you know those things. But most of your questions are on here. So when you come in for your oral, I will tell you what time you're giving medications. So you'll pull the medications based on what time, based on your mark. So I think it's like 2 or 3 pills, 3, 4 if you count the liquid. So you'll get those ready, and then the things that you need to do before, because these are practical things. Obviously, you need to do your 6 rights of the medication administration. So there'll be 2 checks in the MAR, in the med room, and then 1 check at the bedside. So those 3 things have to be done. The other thing that you need to make sure that you do is to verbalize what you would really do in the clinical practice. So if you're giving a medication, you need to know about the medication, any contraindications, so why would you not give it? So what would be a contraindication for giving an oral med?
They can't swallow.
They can't swallow. They're MPO for a test. You can't have anything by mouth.
The kind of diet they're on?
What kind of diet they're on, potentially. So those are the type of things that you need to make sure. Obviously, if they can't have anything by mouth, then we need to really look at that. Now, I will tell you that's not set in stone. A lot of times if they're MPO, there are certain things that we do give with the sip of water. But for our intents and purposes, you do need to know if they're MPO or if they have a swallowing problem. The other thing that you need to check is, do they have any contraindication to having certain liquids? So typically I just tell students to say I'm going to give them with water because that's the safest liquid that you can give stuff with. Some of the others like dairy and a lot of your citrus can interact with some of your drugs. Grapefruit juice is one of the big ones with your like cholesterol medications. So you could just, I think on your checkoff sheet, just ask about preferences for fluid. For this, you can just say I'm just going to give it with water because I know that won't interact with any of the medications that I'm given. Okay. The other thing would be checking your armband. That is a hard stop. If you don't check your armband, then you will not be successful on the oral med checkoff. Okay, it's that important. We get out of the habit of doing it, but that is a hard stop. So if you don't check the armband, you will have to repeat the checkoff. Okay. That's pretty much it. It's really, I know y'all are stressed out about it, but the oral meds are not usually a huge deal. The biggest thing is just making sure you do the checks.
We have to wear gloves when we do oral.
No, not unless you're putting it in their mouth. If you, I mean, to get them ready, no. If you're going to have to physically place them in the patient's mouth, then yes, you put gloves on at that point. So,
Do we have to mix insulin like we did with you in there?
possibly.
Is that gonna be a sheet that we're gonna write on, or is that just
Yes.
for you?
So what we'll do in the morning is I'll give you the sheet, and then you will fill out the stuff that you need to fill out before. So there's like 2 tables, and then there's 6 questions, but some of them have several parts to them. So once you finish that, this is kind of your ticket in the door.
Okay.
So what you'll do is you have to attend all stations. So it'll be me and Miss Brown and Miss Peggy. And Miss Brown will probably do sub-Q and intradermal. I will probably do IM, and Miss Peggy will probably do oral meds. Right now, that's how we've got that planned. So you will have to make a trip to all of us. So this right here is actually for us to fill out your checkoff. So we'll put your score, 1, 2, 3, whatever, and then our initials and any comments. So you'll carry this with you to each station until you're complete, and the last station you complete, you can leave it with that instructor.
For IM, will we do the locations on our partner?
Probably. I'll probably have you, at least for that station, come in a pair, because I can do 2 techniques at the same time. So if you come in as 2, and they may do the same thing for your sub-Q intradermal, For oral meds, it's kinda hard to do more than one at a time, but those usually go pretty quick. So usually if you come in as a pair, you would do sites, they would do sites, and then I'd have you both draw it up at the same time like me, cause I can watch two of you at the same time. That kinda speeds the process up a little bit. So yes, we'll probably do that. For your sub-Q sites, there's not really any landmarks, it's basically just knowing where they are. So for your sub-Q sites, you're looking at outer aspect of the arm, lower abdomen, lower back, and anterior thigh. Now for your IM, I'm a little more of a stickler about that, so you do need to know your landmarks for those. I think we're probably gonna try to start checkoffs around 9 tomorrow. I think she's gonna do Cerner first. So if you do have any questions about the site, just find me in the morning and grab a partner and bring them in. Let's make sure that you understand that component. But for the oral meds, I will have everything set out. You'll have your MAR, you'll have your physician's order, you'll check everything, and then you'll come in and say, I would just make sure that I've done my checks, that I've made sure there's not any reason I can't give these oral meds, that I've checked whatever labs I need to check, and I'm gonna give them with water. The other thing is, it takes usually about 30 minutes to an hour after those medications, so if you were asked how long would you wait to come back and evaluate, let's say you were given a blood pressure medicine and you gave it, how long are you gonna wait to come back and actually see if it's working? 30 minutes to an hour. It's gonna take at least 30 minutes for it to start working.
Were you gonna say you'll do the 6, right? And
And that's one of your questions on there.
Are we
And the 3,
3 checks.
3 what?
3 checks.
Are we, choosing the needle size and everything?
I will have the stuff out, at each station for you to pick, so you will have to pick something that's appropriate. But there's questions on here related to sizes and stuff, so mainly, there won't be, 5 vegan options, yeah.
Now, are we doing that packet before we go in
Yes.
there? So we'll be in here doing the packet and then we'll
Yes.
go in.
Yes, exactly.
I
And
know
then if it gets to where y'all are taking a long time on this, I may pull some people. I don't wanna delay starting checkoff because of the packet, but at the same time, the packet kinda need to do first.
Yeah.
So, and I don't think it'll take you that long to do it.
Can you repeat the 3 checks for me?
The checks, you're gonna do 2, if you're in the real world, you're gonna do 2 in the med room, so 2 at whatever station you're stationed at, and then 1 at the bedside. You're checking the same rights each time, you're just doing it a little bit differently. For instance, the last check is when you're gonna check the armband, cause that's when you're gonna be in the room to actually have an armband to check. And so it'll be set up just like it was last time, where you have an arm or hand and it has an armband on it. Okay? The other thing is, of course, to make sure that you sit your patient up when you're giving oral meds. You're not gonna give them flat, obviously. And then if they have an NG tube in and you give something orally, if it's hooked to suction, what's gonna happen to it?
It's
gonna come right back out. So you would have to get permission or know that it's okay with your physician to clamp it. So you would give the med, clamp it until it absorbs and then reconnect it. We don't do that a lot. If they're on suction, there's usually a reason. And so typically those meds are changed to an IV form or some other form until we can get them where they're eating again. Now, if you're doing it through a PEG tube, then obviously you can crush them and give them unless they're extended release or all those things we've already talked about. So the questions that we're gonna ask you are gonna be things that you already know. Okay?
I was gonna ask about PEG too, if
Yeah.
you're gonna ask that.
We won't have one set up to give meds through a PEG tube, but I may have a question on here about, seems like I do have a question on here about that.